Before I had my surgery, I was quite restricted in what I could do, and I couldn't really exert myself in any major or minor way actually. I would get asthma-like symptoms and difficulty breathing. I would get out of breath, literally sometimes getting out of the car. I was diagnosed with hypertrophic cardiomyopathy here in Ireland, but wasn't offered any treatment other than some drug treatment, which I really found very ineffective. Then in kind of frustration with that situation, I did what people say you shouldn't do. I went home and I Googled where is the world's Centre for HCM, the Centre of Excellence, and came across the Mayo Clinic, and that was the beginning of the journey really.
So from my first consultations and meeting with Mr. Kenneally, it became very clear he was very curious. He wanted to understand his diagnosis and he wanted to explore options of definitive treatment.
I remember when he went to the Mayo Clinic in London and had testing done there and met with the doctors there. Within a day he was able to tell us really what they found was going on, and he was finally being seen in a way that they also were acknowledging, yes, something is not right here.
I'm very, very proud of having all cardiac imaging service in hand, and comparing to other places, you may have all the results within one single day here, whereas it could take several months elsewhere.
They were quite quick to actually identify why I had the symptoms I had due to an obstruction in the blood flow in my heart.
My team and CV International first heard about this patient when we got a request from our London group. Once we do, we figure out which appropriate physician would be best.
Like many patients that enter the clinic now, the first meeting was by video conference. That was set up through the Mayo Clinic office in London. For patients that have limiting symptoms that don't respond to medical treatment, who remain limited, as Mr. Kenneally was, the options then are going ahead with what we call septal reduction. It's open heart surgery in the usual sense, done through an incision in the front of the chest. The reason for surgery in a patient with hypertrophic cardiomyopathy is to improve their symptoms, because you can actually get a patient back to a relatively normal life once the outflow tract obstruction is relieved.
They understood my symptoms and what I was going through with it, and were confident that there was something that they could do to improve my condition. Then I was in the hands of the people who do this particular surgery more than anywhere else in the world and have a fantastic success rate with it.
When we first arrived for our appointments in the Mayo Clinic in Rochester, it's very organised of where you need to be and what's going to happen, when it's going to happen.
The efficiency of the setup is incredible. So all my appointments were on the app. We showed up on time, we were seen on time, we were moved around. Super professional, super friendly, couldn't have been better.
During the operation, we remove muscle from beneath the aortic valve to relieve that obstruction, and that's effective in relieving symptoms in 95% of patients.
It's been 7 or 8 months now since the surgery, and yeah, I'm feeling much better. Don't suffer any of the symptoms I had previously. I'm able to do almost anything I would like to do actually. I'm very grateful for the outcome, and I was very fortunate to meet the people I met along the journey.
Each year we see over 1 million of patients from 140 countries. The biggest privilege working here is the opportunity of working together with specialists in the US in a collaborative way of solving medical problems. It has been really touching to see that we offered him the second chance to regain his quality of life.
I would recommend the Mayo Clinic to others because I feel they specialise in certain things and they do a lot of it, so they're good at it. They're at the forefront of anything that's different or new or difficult. There's hope.
The needs of the patient come first is a value that Mayo holds in the highest regard. We want to make your experience at Mayo Clinic as seamless as possible to get you here, to get you the help that you need.
I think if you're in the UK and you want a second opinion, the Mayo Clinic office in London is absolutely the best place to go, because the person has access to all of the expertise, over 4,000 specialists. So when you get a consultation in London, you're not getting just that person's experience, but you're you'll get the shared experience of the larger Mayo Clinic system.